Welcome back. We're unpacking Bill C-64, which is known as the Pharmacare Act, that has passed the House of Commons and is working its way through the Senate. And joining me is Dr. Joel Lexchin, who's a retired emergency physician and is an associate professor at the University of Toronto. Dr. Lexchin, obviously you examined Bill C-64. For many people, it falls majorly short. As you pointed out, it only covers contraception and diabetic medication. Could be expanded. We'll see. What is one of the major flaws that you feel exists with this legislation?
Well, the the last problem that I think is quite significant is the fact that the federal government is going to have to negotiate with each of the provinces. So this is not something. This is not a fiat coming down from on high in Ottawa. This is going to be 10 provincial and 3 territorial negotiations. We already have Alberta and Quebec saying that they're not going to participate in the plan. Um, the participation from New Brunswick is not clear. And how long are these negotiations going to take? So if we have another federal election in 2025 October and nothing is in place with any of the provinces, it gets relatively easy for a government that doesn't like the idea of universal pharmacare to say, well, you're not getting anything at this point, so we'll just forget about it.
Right. Well, as if we look at current polling and as the lay of the land looks, um, it seems that the Conservatives are headed for a majority. Now, a lot can happen. Election or politics is very exciting. That every day something can happen and completely changes the dynamic. But if the election were held today, that's what looks like would happen. Have the Conservatives, who, again, we are going to assume if the election were held today would form a majority government, have they commented on pharmacare and would they expand? Would they keep it? What has there been their reaction?
The reaction has been ambiguous at best. Um, the Conservatives did not vote in favor of the legislation in the House, and it's not clear from past policy statements that they've had during when we've had previous elections that they would be in favor of this kind of thing. So unless the federal government is able to successfully negotiate with at least a few of the provinces, and particularly with a few of the larger provinces, this may be dead in the water.
Well, it's a definitely will be a hefty financial bill if it passes and it expands to pretty much all medication. Uh, Recent reports from 2021 to 2022 during that time frame uh, purport that 36.6 billion is what Canadians spend on prescription medication. That's a lot of money. But of that, 46% is alleged to be covered by public funds already. Uh, some people will suggest that we just can't afford this. Universal health care is already not, it's underfunded. Why would we want to add to more underfunding by expanding now to pharmacare? Would that undermine the healthcare system, in your opinion?
No, first of all, you're right about the total amount we spend on prescription drugs. But if we had a national plan, the estimates are that the total spending, this is the combined private and public spending, would actually go down from 36 billion to about 33 billion or 34 billion. So we would overall save, yes, the public would be spending more. But the other point around the cost of this is that we only seem to talk about where's the money going to come from when we're talking about social programs. So when the federal government committed to spending $75 billion on C-35s, nobody said we're going to have to organize bake sales to pay for it. When the federal government and the provincial governments committed to spending, I believe, over 30 billion on electric battery plants, nobody said where's the money going to come from that. When we
Mm.
bought the Trans Mountain Pipeline for what turns out to be, I think it's about 20 billion. Nobody asked where the money is going to come from that. We only asked where's the money going to come from for childcare? Where's the money going to come from for pharmacare? This seems to me to be a distortion of where our priorities should be.
Yeah, fair points. Very interesting points. And we can unpack that a little bit more after we come from the commercial break. But I also want to talk about when we return about prevention, those who maybe don't use pharmaceuticals and want to do more preventative measures. What's in this for them? We'll be right back.